Hello and welcome to Sumhio Medical Center, Department of Interventional Radiology. We'd like to share with you some highlights of our strategic plan. Our mission, transforming healthcare by utilizing state-of-the-art medical imaging technology, led by the region's top interventional radiologists to provide innovative, high-quality, and cost-effective services for our patients. Our vision, distinguish ourselves as a national center of excellence within the field of interventional radiology by streamlining access to high-quality care, improving patient outcomes through innovative research, and fostering the development of well-trained faculty and staff, resulting in an unparalleled patient experience. We value each person as a leader. We support a culture of creativity, courage, curiosity, compassion, and innovation. We thrive on collaboration and a multidisciplinary focus, fostering an atmosphere of teamwork. Relationship-based care is our priority. We are determined to exceed our own expectations, and we welcome and embrace diversity and inclusiveness while providing the highest quality care. We set up our strategic planning process with rules and guidelines that made sure that everyone was in alignment and shared the same values. Our stakeholder group would be diverse. We expected people to be engaged and accountable. We clearly defined everyone's roles and their responsibilities. We wanted defined timelines. We would adhere to any regulatory guidelines or safety protocols. Our plan would include evidence-based practice, and we wanted to encourage a culture of trust, a spirit of inquiry, look at mistakes as opportunities, respect, and diversity. Our SWOT analysis showcased our strengths: a generous budget, a generous capital budget, strong internal referral base, our central location. We have an advanced EMR. We have a motivated and innovative medical and administrative leadership team. Our non-provider compensation package is enticing. The clinical skill level of our providers are outstanding. We engage in teamwork. The agility of our staff is commendable, and we all share a passion for purpose. During our SWOT analysis, our weaknesses demonstrated that we had some concerns with our provider compensation model, as currently interventional radiology procedures are generating very low RVUs. We share a space with multiple procedure departments. We have outdated and manual processes, a poor recruiting model, a weak org chart with no distinct leader, poor access, and a recent increase in infection as well as ED and hospital readmissions. Our group was excited to identify opportunities that we thought we could capitalize on. Currently, there is not a niche market in our region for interventional radiology, especially advanced procedures. We need to look at our external community referring offices to try and improve our referral base. We must streamline the referral process to make it easy for our internal as well as our external providers to refer patients to us. We must invest in cutting-edge technology so that we can stand apart from our competitors. And we are looking at providing pre and post education via telehealth or within our new outpatient clinic in an effort to improve the patient experience and reduce ED and hospital admissions. Threats, while not very many, must be taken very seriously. We will continue to focus on CMS regulations as well as our reimbursement model. The neighboring hospital in Central Ohio does have 3 times the IR faculty, which leads to better access for that organization than what we currently have. We also want to be very mindful of outside perception and reputation. We need to work very hard with our marketing and outreach partners so that we can regain the trust not only of our community providers but our internal departments as well. And we are concerned that our research funding may be limited this year due to the current economic status of our country. So how can we make ourselves more diverse? We want to continue to develop our in-house lab for immediate biopsy analysis. We want to utilize the mobile unit so that we can establish a community presence. We want to continue to acquire unused clinical space so that we can create that interventional radiology suite that we spoke about, including an outpatient clinic. Assuming responsibility for PEG tube placements, paras, and thoras from general surgery is also on our list. And we want to partner with local referring offices in the community and expand our referral base from internal to external as well. Why choose Sumhio Interventional Radiology? Because of our cutting edge imaging technology, is we're the only medical center in central Ohio with biplane fluoroscopy and 3 CT scanners with CT fluoro. We can offer around the clock access for both inpatient and outpatient procedures. Ambulatory procedure appointments will become available 7 days a week, and weekend coverage for inpatient procedures will help with getting patients discharged on time. Our culture will drive performance at the clinical, operational, and financial level. Our culture will fuel innovation and serve as a beacon to attract and retain top talent. Long-term goals focus on a share of the available regional market. What can make us be an outstanding national leader, in particular in women's health? Our financial results are pretty robust with a 25% increase in not only referrals but patient completed procedures. And then we also want to look at technology and make sure that we can advance not only our medical imaging but our telehealth technology. Short-term goals include creating an environment where interventional radiology at Sumhio is a workplace of choice. We would like to achieve outstanding patient satisfaction and customer service scores as reflected in our Press Ganey patient satisfaction surveys. And we also want to see a significant increase in our post-procedure infection rates and unplanned admissions. We have 7 key pillars that we will look at throughout our strategic plan over the next 5 years. We're going to start off with hiring a nationally recognized IR medical director whose reputation for both clinical excellence, innovation, and collaboration will attract top-level physicians. We want to focus on staff training, capital equipment, marketing, patient flow, reimbursement, and sustainability. We will continue to share our progress on a regular basis as we continue to strive towards excellence. Patients, faculty, and staff will always be our greatest assets, as all are instrumental in working towards this new vision.